So you're not sure which travel nursing contract to take. You have two offers, they both look pretty similar, and you have less than 24 hours to decide. What are the things that you should be looking at when you're considering taking travel nursing contracts? And how does the math not always add up to what you just see in the bottom line of the contract? Welcome to my channel. My name is Anna. I have been a nurse for about 3.5 years, a travel nurse for about 2.5 years, and I'm currently a first-year student registered nurse anesthetist and part-time travel PACU nurse. I'm also a critical care nurse educator. Today we're talking about how you should weigh all of the different factors that come into play when you're looking at different travel nursing contracts. The first thing before we even get into the side-by-side comparison of different contracts is you have to decide what is the most important to you. Everyone is going to have a different priority when it comes to travel nursing. Some people are in it for the location. Some people don't really care how much the money is as long as they are in New York City. Other people don't care about the location as long as they're at the highest paying contract. Most people are somewhere in the middle where they have a couple of factors that are important. I encourage you, before you get on the phone with a recruiter and before you go in and apply and before you hit accept on a travel offer, to write down physically, either on your phone or on a piece of paper, what your top priorities for this first travel nursing contract is. Do you want location, and is that the most important to you? Is it money? Is it some other factor? So write out what's important to you and then stick to those values before you accept any other contract. Now we get into the side-by-side comparison. Contract A, I have $5,100 a week in Washington, D.C. for 48 hours. Contract B, I have $4,000 a week for 36 hours also in Washington, D.C. So comparing these two numbers, of course, the first thing you're gonna see is that you would wanna go for the $5,000 a week contract. I would say that it's really important to break down hourly what you're looking at, and I would say pause before hitting accept for any 48-hour contracts. There are a couple of different things that make up your compensation package as a travel nurse. You have your base pay, you have your overtime pay, you have your call pay, you have your night differential pay, and you have your tax-free stipend. So $4,000 versus $5,000, let's do a little breakdown. Let's make an estimation that in Washington, D.C., tax-free stipend it'll probably be around like $1,700 a week, maybe $1,500. We can say $1,500 just for the sake of argument. So you subtract $1,500 from both contracts. Then you need to calculate out the hourly rate for both. And this is where you're gonna get in to see that for the 36-hour contract, if you were to work 48 hours, you would be making just as much money as if you took the $5,000 contract. I say you should almost never sign a 48-hour contract. You are signing up to work overtime for 13 weeks. And places that are short-staffed, the working conditions likely aren't amazing. So you're going to be burning yourself out. And this is one of those things where if you have a monetary goal where you are trying to pay off your car payment or your student loans and you are going to do anything that it takes for 13 weeks, good for you. If you want to keep up longevity as a travel nurse and take care of yourself, I like to always advise people to take the 36-hour option, and then you can always pick up overtime if you have extra energy to do so. That being said, and if you do that, then you would make the $5,000 a week. Sometimes you'd even make more on a 36-hour contract, depending on what the overtime laws. In California, the hospitals are supposed to pay overtime after 8 hours and double time after 12. So if you sign for a 36-hour contract and you do one 16-hour shift every other week or so, you end up taking home more money than if you were signing like a 48-hour contract. All of that aside, I would just say always calculate out what the hourly rates are. And if it's the same amount of money to take a 36-hour contract versus a 48-hour contract, if you pick up overtime, always go with the 36 hours because you always want the option to pick up, but you don't want to be forced to be there 4 or 5 days a week. That's just my personal 2 cents. You might disagree, but I would always say take the 36-hour contract and then pick up overtime if you feel like it. One last thing about the 48-hour contract versus a 36-hour contract, oftentimes they will only have a 48-hour contract listed. Always ask for 36. Sometimes the facility will take it, sometimes they won't. Most of the times they're short-staffed and they will. So just because you see that a contract is listed as 60 hours a week or 48 hours a week, doesn't mean that you can't make it a 36-hour contract. And with travel nursing and with the rest of life, if you do not ask, the answer is no. So always ask and then see where the cards fall. The next thing, when comparing these two contracts, the 4,100 versus the 5,100, and also every single travel nursing contract, is that you need to ask yourself, is your license going to be safe practicing at this facility? Because at the end of the day, even though travel nursing can be amazing money for 13 weeks, if you lose your nursing license because you get sued because you were operating outside of your scope of practice and a lot of harm was done at the hospital because they were so short-staffed, you only get one nursing license. So you need to ask yourself why the contract is paying so high, and you need to make sure that you're going to be working somewhere where you're protecting yourself, your license, and your patients. I also say it's usually not worth it to take the highest paying contract. The highest paying contract is typically not the place where you want to be working. This is also a situation where I would recommend carrying malpractice insurance. Malpractice insurance that is carried by your agency or by the hospital will not cover you for board of nursing issues. And then also, if there is an issue and something is brought to court, oftentimes the hospital or the agency will not continue your employment, so then you will not be under their malpractice insurance. So it's worth it. It's like $100 a year. I am not affiliated with them. I would be open to it, but I'm not making any money off of the affiliate link, but I'll have the link down below for NSO. They have pretty good malpractice insurance, and I think it's just something to protect your license. Also, always just make sure that you are taking a job where you're going to be operating safely as a nurse and as a travel nurse. Other questions to ask your recruiter before you sign talking about the safety of the workplace is, do they have a union? Union hospitals, they have protections for their workers, and they are not going to be able to lay off and fire people indiscriminately. You are going to then benefit as a travel nurse from those unions, especially if you are in California, where the unions pass the laws about the nurse to patient ratios, where the unions are going to make sure that you get like 2 or 3 breaks during your shift. It's just good information for you to have as you are comparing different contracts. It's not necessarily going to be a make or break deal as a travel nurse going to a union versus a non-union facility. But of course, it's always better to work in a safer working environment, and nurses who have a union are safer with their representation and their collective action. The next thing to consider is how many travelers do they have there and how many new grads. It's not safe to walk into a place where it's like 80% travelers and 20% new grads. These are questions that you can ask during your interview with the manager. It's just important for you to make sure that you are going in to help, but that you are also protecting yourself and your nursing license when you're considering different travel nursing contracts. Now, considering these 2 contracts, back to this example once again, in Washington, D.C., the $4,000 versus the $5,000 a week contracts, there's also, you need to consider night shift differential and whether it actually pays more and if there's any call requirement. So if you're taking a PACU job, they might have you taking call. That would be something to flesh out as far as the contract and call requirements. Also in DC, I would also argue that if a contract doesn't pay you more to do night shift and you're a day shift person, I'm going to take the day shift contract. And if you love night shifts and you're going to choose night shift even if you don't make any more money, absolutely. But for me, as somebody who has a day shift preference, if there's no difference in the pay packages between night shift and day shift, I'm personally going to choose day shift every single time. And then the next thing to consider is looking at the per diem rates, AKA your tax-free stipend. And then you also need to look at how much money you are getting in your tax-free stipend. This is actually set federally. At the federal level, there are rules about how much you can give to an employee who is there for per diem or travel work every single day. So a travel nurse who is working in San Francisco is going to be allowed and allotted a higher amount in per diem than someone who is working in Alabama. What they mean by per diem is just the cost of paying for your rent and your food for a day. This is not talking about per diem nursing, which is this video. You can go check out that video right here. Also, I'm gonna flash up here, we have the GSA. This is set by the government. And this is going to tell you how much money you can make every single day to cover your rent and your food and your transportation. I would always cross-reference this federal guideline with your travel nurse agency to make sure that you are making the maximum amount allowed by the government, because it's going to be tax advantageous for you, for the agency, everyone involved. So always make sure that your travel contract is paying you the most that they can in the tax-free housing stipends. Also, once again, you cannot take the tax-free stipend if you are not duplicating your expenses. Also, just make sure that you're working with a tax consultant all the time, and that you're truly duplicating your expenses and that you qualify for the tax-free stipend. And then always just calculate out by the hour the comparison between 2 different contracts. The next thing to consider when looking at these 2 contracts is the cost of living. Both of these contracts I picked because they're both in DC, just to compare between 2 different contracts that are likely at the same hospital. However, cost of living is a big factor to consider when you're looking at a contract. So if you have a $3,000 a week contract in North Dakota versus a $3,000 a week contract in San Diego, you are going to be taking home a lot less money in San Diego if those 2 things are equal. Because you also have to factor in the cost of transportation and rent and food in a given area. Of course, like we just talked about in the last point, you're allowed to have a higher percentage of your income, your weekly income, be tax-free in high cost of living areas. But you do need to kind of calculate out the average cost of living in an area between two different contracts. And this is where it's going to circle back to the first point, which was, what are your goals? Are your goals to enjoy new cities and travel to and learn how to surf in San Diego? Or is your goal to take home as much money as possible in a 13-week contract? And that's gonna weigh your decision one way or the other, because you are going to take home less money if both contracts are equal in a place where the rent is higher. So that's something to consider. Comment if you would like for me to talk about where, like, cost of living in different areas, and then housing options for travel nursing, and then comment any other questions that you might have. I really enjoy this. I think I also might get into just comparing two contracts, and then let me know if you'd like that to be a series talking about why I would personally choose one contractor over the other, just to kind of give y'all a feel for choosing between different contracts. Let me know if that's something you would be interested in as well. Thank you so much for your support. I'll see you next time.